So I became a nurse about 2 years ago, and I started in the emergency department. So I've been working in the ER throughout this entire pandemic. And we work really closely with a lot of COVID patients. And I've been working in a lot of the COVID rooms more frequently because we've had a lot of COVID patients. And then shortly after a few of my shifts in the COVID rooms, I started feeling ill. But of course, I'd already come home with my family and exposed them. So I tested positive a couple days after feeling ill. And Aurora started feeling sick that night as well. We tried to just stay home and manage our symptoms. I was fine after a few days, but after about a week, we started noticing that Aurora, it looked like she was taking a turn for the worst. So we had some paramedics come out just to check all our vital signs, and they recommended we go to the ER and get evaluated. And they admitted us to the hospital for COVID pneumonia. And she started looking a little better and then started going a little bit downhill. And now we're in the PICU, and we're on our 8th day in the hospital right now. That first night is when she got sick. Every time she's had a cold or anything, she gets really sick at night. So she just had a low-grade fever, and she was congested and had a slight cough. But then over the next 3 or 4 days, that all started getting more severe. It was a really productive cough, high fevers. We couldn't keep them down. And then at about the week mark, she was really lethargic. We could barely keep her awake. Her fevers were like 104 to 105. She wasn't eating or drinking. And we just started getting really worried that she might have had pneumonia. That's what we were suspicious of. And we had a pulse ox at home, and we were checking her oxygen, and we noticed that it was low. So we had the paramedics come out to verify, and they agreed with us that her vital signs didn't look good and she needed to come in to get seen. They took us to a room immediately after they triaged her so that they could put her on the monitors. They told us that her fever was 106.8 whenever they checked her in, and her heart rate was 165. Her pulse ox was 88%, so they needed to put her on a little bit of oxygen. So they put her on the monitoring really closely, and then as soon as the doctor came in, they were like, yeah, she's probably got pneumonia. They did some x-rays to verify it, started an IV so they could get some fluids going and get her rehydrated, and then told us that we needed to stay in the hospital to continue getting the oxygen and getting the fluids and getting the antibiotics. So she started off only needing like half a liter of oxygen. That's how much they had her on when they decided to admit her. So she barely even needed oxygen. And then it progressed to needing like 1 or sometimes 2 liters when she was in a deep sleep. And then on about the 4th or 5th day that we were here, they were starting to lower her oxygen. She almost made it through the night without even needing oxygen. But then during the day, her sats would drop drastically into the mid-70s just with any type of movement. And they'd have to put her on like 6 to 10 liters to bring her up after that drop. And then she'd recover after that. But then all of a sudden, after waking up from a nap, she was just in sudden respiratory distress. We have no idea what caused it. She woke up from sleeping and was just panicking like she couldn't breathe. Her sats dropped. We put her on the maximum amount of oxygen. A lot of people came in. It's called a CRIT. It's a children's rapid intervention team. They came up and evaluated her, and a lot of interventions happened all at once, and they just couldn't get her sats to come back up. So they brought her down here to the PICU to put her on BiPAP so she could be more closely monitored. I know that a lot of people are saying that I don't want the vaccine. This is my body. It's my choice what I do with my body. And I understand that. But in my opinion, I don't think that applies to this situation, because when you choose not to be vaccinated, if you were to catch COVID, you're exposing much more people to COVID, and you're exposing people to COVID that don't have the choice to get the vaccine. So for those that are unvaccinated and that they go in public, or even if they don't go in public and need treatment in the hospital after catching COVID, that I take care of them, and then I'm exposing myself. And that's how in turn I brought it home to my daughter, because maybe if they would have received the vaccine, they could have stayed home. They didn't have to get treatment in the hospital, and I wouldn't have had that exposure, and I wouldn't have brought it home to my daughter. It's a lot of guilt and frustration and a lot of what ifs on my part. Like, maybe if more people would be vaccinated, I wouldn't have had the exposure that caused me to bring this illness to my daughter. There's two sides of it. I'm glad to have the knowledge that I have, just because I can help explain things to my husband. I can kind of explain things to Aurora and my family with updates and everything. But I also wish that I didn't have the knowledge that I have sometimes, because it's really hard seeing what I've seen for the past 18 months and then watching my daughter go through it and then seeing her get worse and knowing what happens next. So sometimes I wish that I was completely clueless, so that I didn't know what can happen. But I'm also happy that I'm able to help explain things to my family and to other people that may not understand exactly what's happening.
For more information, you can visit tulsaworld.com.